So families are now being asked to extend COVID-19 infection prevention measures to their homes in the wake of rising infections at the family level. So the Ministry of Health is advocating that families clean shared surfaces regularly and put on masks at home, a requirement that may be challenging for the Kenyan setup where several households share rooms and amenities, as Sam Gituku reports.
As studies continue into the chains of transmission of the new coronavirus, evidence already indicates that up to 81 cases in the country can be traced to an initial 7 positive cases, a disease that sets in before symptoms show and when signs appear. In most instances, it's too late to protect the contacts. In Nairobi's 6 confirmed transmission chains, a mother or head of a household picked the virus, mostly from their place of work or a friend's house, taking it to the family members. In the Kawangware transmission chain, for instance, that accounts for 14 subsequent infections, they were only detected after the initial case provided a list of contacts. The contacts were observed, and within 14 days, half of them tested positive. The challenge now being how members of a family or domestic workers can be protected despite sharing most of the amenities. The Ministry of Health now advocating for extension of the preventive measures into homes.
You can exercise the hygiene that is required there. You can exercise social distancing. It is difficult times and we have to do some very, very unusual things.
If you're not able to maintain physical distance at home, then it is imperative that we continuously use our masks even at home.
While many Kenyans strive to observe social distancing while in public places, Kenya's 2019 census shows that the average Kenyan household has 4 members. But in some counties, the average goes up to 7 members in a household. In reality, in some homes, the size is higher than 7, yet all of them have to share limited space in the houses they occupy. Majority of Kenyans share bathrooms and toilets, where more than half the population uses a pit latrine. Many Kenyans share bedrooms, if not beds, and thus at a high risk of infection should the virus reach home.
The infection prevention control measures must also extend to the other areas in the house, including our seats and chairs, the toilet facilities, and also all other linen that we use. Avoid sharing of linen in case you are so many in a house.
Despite stoppage of social gatherings, Kenyans continue to visit each other, just in limited numbers. Evidence shows neighbors have contracted the virus from their neighbor friends. The ministry's attention now drawn to a growing number of COVID-19 patients who have died at home under the care of families that had no idea they were dealing with the virus.
Deaths that occur at community level are signs that these people have a severe form of the disease. Therefore, they are more symptomatic and therefore heavy shedders of the virus. Those who take care of them and those who are in close proximity to them are at a very high risk of acquiring the infection from them.
The complexity of a virus that is so difficult to stem, targeting the unsuspecting, and now threatening the comfort and warmth of family. Sam Gituku, TV, Nairobi.